COVID-19 cases are increasing across the globe, and as the holidays are being celebrated, folks are scrambling to get tested using various COVID-19 testing kits. 23 ABC's Brianna Polk explains the approach to how accurate and effective rapid antigen tests really are.
COVID-19 tests have been at a high demand, especially after the holiday season. And with the rise of the Omicron variant, many folks are concerned with the sensitivity and efficacy of rapid tests in comparison to PCR tests.
When you're dealing with an antigen test, everyone knows from the beginning that it is not, by the nature of the technical aspect of the test, as sensitive as a PCR. So it isn't 100% sensitive and not like a PCR, but it has a considerable degree of usefulness in a number of different circumstances.
White House medical advisor Dr. Anthony Fauci says that while rapid tests are not 100% sensitive, it is still a critical tool to stop the spread of COVID-19. He adds that when it comes to the utilization of rapid tests, there is a reduction in sensitivity, not a total disappearance.
When they were looking at the sensitivity with regard to Omicron, in some of the tests, there appears to be somewhat of a diminution, not a disappearance, but a diminution of the sensitivity.
Dr. Hayes of Omni Family Health says that while rapid tests are able to detect asymptomatic cases, people get positive results when they have COVID-19 symptoms, as they are most contagious. He advises that if your rapid test is negative, a PCR test is the next best thing to do.
Antigen tests are much less sensitive in people who are asymptomatic, but they're still useful, and we can still use them to screen people. Certainly, if you have symptoms, they will work better. If you have symptoms and your rapid test is negative, then you may want to talk to your doctor about going ahead and getting a PCR test as well.
According to the California Department of Public Health, repeat antigen testing should be considered in individuals who receive a negative test result from a rapid test, but have symptoms specific for COVID-19, such as loss of taste and smell. Coming up at 6, we'll have more on the different processes of PCR and antigen testing and what exactly the results mean, whether positive, negative, or even false negative. Brianna Polk, 23 ABC News, connecting you.